supine figure 4 stretch on extended knee. For this stretch therapy modality, you'll have your client sit on the edge of the table and then have them brace, use their abdomen as they lay back onto the table. And as they come up, if your client's more athletic or more capable, they can go into this position on their own. And it's crossing the ankle. Of course, you're going to do this on both sides, and depending on the client's mobility restrictions, maybe more focus on one side than the other. But what we're doing is we're stretching the external rotators on this left hip. So let's switch legs just for a second. So yeah, what we're doing is we're primarily stretching the external rotators in the glute and hip here on the side that's crossed. The extended knee position is also going to be stretching the hamstring and also the lower posterior chain, okay? We're going to show the other side for the video here. So what I want you to do is have the client cross their leg just above the knee, right? From this position, looks like below the knee, but we'll always look at this from a standing position, right? So just above the knee, and then they're going to dorsiflex the ankle on this side. What that does is it uses some of the lower leg musculature to give a little better stability to the knee. Just makes the stretch a little bit safer. Now, what you'll find is if you just kind of push, this leg will cave in, so you can't do the stretch like that. And if you really start trying to pull and go like this with the client, pulling on this leg, what will happen is it'll start to create a lateral pelvic shift, or like a Trendelenburg in the pelvis with the client on the table. So what you'd want to do is instead, you can actually, in this one, actually have the client give you a little bit of assistance. So they're just going to apply a very moderate pressure against the thigh so that you can push back onto the thigh. Now really what their pressure is doing is it's not pushing directly back. You're not having kind of like a push tug of war type of thing going on. They're keeping this alignment, and then when you push, you're getting that additional hip flexion motion, okay? So we're applying pressure here at the ball of the foot. Easiest, best position, because it's going to get the lower posterior chain, hamstring, keep the knee straight, accomplishes everything at once. It's your greatest leverage point onto the client. The client will press moderately, and you'll do your best to keep that pelvis nice and square while applying the stretch.